Okay, so hi friends, now we are starting the session on what should you understand as far as management and logic of urge incontinence is concerned. Okay, now see, urge incontinence is something which is extremely commonly present in women across all the age groups, but it is most commonly seen in women who are in the postmenopausal age group category. All right, in those women you are going to see this the most common. All right, absolutely common. So that is something which you have to keep in mind. Second, how do you diagnose urge incontinence as a family physician in your routine practice? Okay, so diagnosis of urge incontinence is something which is very easy. The patient should complain to you that she is unable to control urine even before reaching, even before the patient reaches to pass urine. The minute she gets the urge to pass it, okay, there is an uncontrollable urge. All right, that is something which you have to keep in mind. This is called as urge incontinence. Okay, it is not that they don't understand if the bladder is full or not. It is not that. The problem is the minute they understand the bladder is full, the minute they get an urge to pass urine, even before they are able to reach the washroom, urine starts to leak. All right. So it's very simple here. See, this means that these patients do not have a leak of urine otherwise. That means during the day, if there is no sensation to pass urine, they are fine. Okay. No problem happens to them. This is because predominantly there is some problem at the molecular level as far as the receptors are concerned. Now, these are predominantly the acetylcholine muscarinic receptors which are present along the bladder. All right. What is going to happen is there is going to be some altered sensation, altered signaling on these receptors. Because of this altered signaling, what happens is the minute the bladder is even slightly full, the contractile pressure of the detrusor muscle goes up tremendously. Because it goes up tremendously, the bladder mechanism is such that it initiates the micturition reflex. And because it initiates the micturition reflex, patient unfortunately passes urine. All right. Another common thing which as family physician you should understand, the most common cause for having urge incontinence is urine infection. Urine infections are very common in the women because the length of the urethra is just 4 centimeters. As a result of this, ascending infections from the vagina can go inside the bladder, and that causes repeated recurrent UTIs, recurrent urinary tract infections. This recurrent urinary tract infections are a major cause of temporary urge incontinence. You will feel and you will understand that when the women wants to has an infection, there is this urge of having frequency of micturition as well. All right, along with bladder pain. So that is something which is very common in our country. Second, obesity is very, very common. These days, you will have a lot of obese women, and in obese women, you have urge incontinence. Third, diabetes mellitus is one of the things which causes severe damage to the microvasculature inside the bladder. This damage to the microvasculature causes altered sensations, and because it causes altered sensations, there is a high risk that these patients also end up having urge incontinence. Okay, remember, urge incontinence due to diabetes is something which is very, very tough to treat. It is not very easy to treat. The patient needs to have an excellent glycemic control in that situation. Okay, apart from all these things, you must 100% understand that whenever you have these problems, the lesser common ones, okay, are going to be something like post radiation cystitis, then some form of bladder stone which is causing irritation, some form of tumors. All these things are there. As family physician, note down one more important point. In postmenopausal women, there is something called as atrophy. Why does this atrophy happen? This atrophy happens because estrogen has gone down. Because the estrogen value has gone down in these women, it is very, very common that these women have atrophic cystitis. Atrophic cystitis, where the bladder epithelium becomes thin, the nerve gets exposed, and this exposed nerve also causes urge incontinence. Very common, very, very, very common. In fact, in India, in post-menopause, atrophic cystitis and atrophic vaginitis, which we also call as senile cystitis and senile vaginitis, are very, very, very common causes of having urine tract infections, urge incontinence, as well as of having vaginal dryness. All right. The entire management of urge incontinence is actually divided into behavioral therapy, medical management, and then if everything fails, then surgical management. All this therapy we are going to discuss as a part of our next short lecture. I hope all of you have enjoyed this short lecture. If there are any questions or doubts, feel free to ask your questions and doubts over WhatsApp or on the messages here. Thank you so much for attending and see you on next Wednesday.